For most of us, a lifeline exists when we're sick or injured. Without a second thought, we can visit a clinic, hospital, or a doctor with costs covered by health insurance, Medicare, or our own financial wherewithal. For some less fortunate, however, the choices are brutal. Endure serious illness or pain without treatment, face formidable medical bills, or bear the indignity of being regarded as a charity case.
A lot of people are low income and they can't afford insurance and everything else, and that's what it is here for me. I live paycheck to paycheck, and this is a blessing for me.
While we are primarily a volunteer-based clinic, we have a full-time staff of nurse practitioners here. We try to make sure the patient has consistent quality care and continuity of care, regardless of how many other providers they may see here at the clinic. Our volunteer primary care and specialty providers are fantastic. But because they're volunteers, they're here intermittently, perhaps once a week, month, or quarter. So it is the nurse practitioner's priority to make sure the patients have seamless and complete care. Because we are a free clinic, we tend to have a high percentage of complicated patients. Many patients who initially come to our clinic have not seen a primary care provider in 5, 10, or even 20 years because they haven't had healthcare coverage. So by the time they find us, they're having symptoms of organ damage due to their chronic diseases. Their hypertension has often led to heart attack, stroke, or cardiomyopathy. Their diabetes has caused renal disease, retinopathy, or neuropathy. Because these patients now need closer monitoring and multidisciplinary care, the nurse practitioners typically take on these more complicated patients. We are able to see them frequently and review labs, vitals, and symptoms routinely and consistently, when a volunteer provider may not have been available so often. We find that this helps to prevent further complications for them and many times keep them out of the hospital.
If the free clinic wasn't here, I'm not sure I would be here right now. I had a stress-related cardiomyopathy attack a few years ago, which if it happens again, I only have a 5% chance of survival. That could have killed me. The aftercare provided by the free clinic helped get me through that period. If it wasn't for the donors, people like me wouldn't get our medications and we wouldn't be able to get our health care.
Welcome to the Clearwater Free Clinic Medication Room. Our budget annually is about $181,000. That includes 2 full-time employees, our medications, and our supplies that we are able to purchase for our prescriptions. The donated patient assistant medications, the insulin, the biologicals, the things that we need to be able to help our patients. Those prescriptions have totaled about $2,356,000 last year alone. Approximately 80% of the CFC population have one or more chronic diseases. So it's no surprise that the clinic distributed well over 43,000 courses of medication last year alone. Accessible medication therapy is a critical component in the management of chronic and acute medical problems, especially for the uninsured. The Clearwater Free Clinic has an extensive medication formulary, knowledgeable support staff with clinician oversight, so patients are able to achieve the best healthcare outcomes.
Offering behavioral health services to clients in the clinic allows the Clearwater Free Clinic to offer truly integrated care. If somebody has a chronic medical illness, anxiety, depression, feeling overwhelmed, it comes along right along with that. So offering therapy can provide them the opportunity to manage their mental health so that they can manage and adjust to their chronic medical illness. So about 98% of the people seen in behavioral health have had some sort of trauma in their life. Studies link past traumas to poor medical health. So by offering behavioral health services to clients at the free clinic, it allows those clients to work on their past traumas, which then in turn helps them manage their medical health.
Clearwater Free Clinic has given me not only access to health care, mental and physical, because you treat the whole person and you care about us. We're able to function and give back to our communities as well.
Our partnership with Baycare is invaluable. It has allowed patients with no health insurance to seamlessly transition from an inpatient hospital setting to a medical care facility where their medical needs can continue to be met. Oftentimes, these patients have never had medical care prior to their hospital admission and have multiple undiagnosed medical conditions that require attention. In addition to finding and establishing with a primary care provider, there are typically new medications, specialist referrals, follow-up imaging or diagnostic testing, or requirements for complex wound care that patients would normally have to arrange for themselves. That's a lot to worry about when you're recovering from an illness and are unsure on how to navigate through the complex web of healthcare. Here at the Clearwater Free Clinic, myself and my nurse practitioner cohorts work closely alongside the Baycare insurance navigators to ensure patients have a medical home to address their complex medical needs. Our Baycare referrals range from simple observational admissions for chest pain to difficult surgical cases and sometimes organ failure. Once we receive a new patient referral from a Baycare facility, we review the patient's hospital chart. During their new patient visit, they will receive a complete physical and examination, education on their new or ongoing disease processes, prescriptions for medications that were started while they were in the hospital, and continued monitoring for any abnormalities or clinical concerns that were found during their hospital stay. If indicated, we'll consult with our fabulous specialty volunteer physicians and arrange for any sort of clinical evaluation. The continuity of care we are able to provide is truly comprehensive, and I can attest that our Baycare referral patients really appreciate us guiding them from discharge to eventual wellness.